Hello and welcome to my channel. In this lecture we'll discuss the summary of the innervation and blood supply and lymphatic drainage of the maxillary and mandibular dentition. So let's begin. The maxillary dentition nerve supply is through the superior alveolar nerves, and these nerves are the posterior, middle, and anterior superior alveolar nerves. They leave the maxillary nerve in the pterygopalatine fossa and pass through the pterygomaxillary fissure between the pterygoid plates and the maxilla, posterior surface of the maxilla, and they enter through foramina, alveolar foramina in the maxilla. The upper branches pass along the posterolateral wall of the maxillary sinus to supply the mucosa lining the maxillary sinus. The lower branches run through canals in the maxilla just above the tooth roots, as you can see here, and they send branches to supply them, as evident in this plate. Some branches do not enter the bone and continue to supply the buccal gingiva of the upper posterior teeth. Now, all of you know that a branch of the maxillary nerve is the infraorbital nerve that enters the orbit and runs on the floor of the orbit till it digs its way in the canal in the floor of the orbit and emerges as the infraorbital nerve at the end to supply the cheek area. And now, each infraorbital nerve runs forwards in its canal to emerge on the face, and middle and anterior, it gives the middle and anterior superior alveolar nerves on its way during its course in the floor of the orbit, and the anterior superior alveolar nerve branches from the infraorbital nerve just before it emerges from the infraorbital foramen, as you can see here. The anterior superior alveolar nerve. It travels down in a canal on the anterior wall of the maxillary sinus in the maxilla to supply the upper anterior teeth. Now, there is a variation in the origin of the middle superior alveolar nerve. Sometimes it's not there, it's not given off. It runs downwards and forwards in the posterior and lateral walls of the maxillary sinus, and this depends on the point of origin of the nerve, from the infraorbital nerve to innervate the premolars and the first molar, the middle superior alveolar nerve. It's absent in about 18% of subjects. The superior alveolar nerves form the superior alveolar plexus, as evident here in this plate, within the maxillary alveolar processes, a short distance above the root apices of the upper teeth. The part of the plexus that's formed by the posterior superior alveolar nerve supply the molar and premolar region, while that formed by the anterior superior alveolar nerve supply the canine and incisor region. The middle superior alveolar nerve, if it's present, it innervates the premolar teeth and the mesiobuccal root of the first molar. This tooth then is innervated by the middle and posterior alveolar superior alveolar nerves. Now, all the superior alveolar nerves supply the mucosa lining the maxillary sinus during their course, and the buccal gingiva are supplied by branches of the posterior superior alveolar as well. The labial gingiva receive their sensory innervation from the superior labial branches of the infraorbital nerve, as evident here. The gingival mucosa covering the palatal aspect of the upper alveolar process is innervated by the greater palatine and nasopalatine nerves. They descend from the maxillary nerve in the pterygopalatine fossa. Now, the blood supply, it follows the nerve supply, follows the blood follows the course of the nerves supplying the teeth. The blood comes from posterior and anterior superior alveolar arteries, branches of the maxillary artery, as mentioned before, it follows the course of the corresponding nerves. Now, the blood supply to the gingiva is also through branches of the maxillary artery corresponding to their nerve supply. The venous drainage by veins which drain into the pterygoid venous plexus in the substance and around the lateral pterygoid muscle, as shown here in this plate. This is the pterygoid venous plexus. Now, regarding the mandibular dentition and supporting tissues, the nerve supply, the lower teeth are innervated by the inferior alveolar nerve. This is the inferior alveolar nerve, and it's a branch of the posterior trunk of the mandibular nerve, and we studied this in the infratemporal fossa, the branches of the mandibular nerve. To remind you, it divides into anterior and posterior divisions. The anterior divisions gives 3 motor branches and 1 sensory, which is the buccal. The posterior division gives 3 sensory and 1 motor branch. Each nerve runs within the mandibular canal below the roots of the posterior teeth, as shown here, as far forwards as the mental foramen, and it emerges to supply the skin of the chin and the inferior lip. The incisive nerve is a branch of the mandibular nerve, is a branch of the inferior alveolar nerve within the mandible, which supplies the canine and incisor teeth. The mental nerve emerges through the foramen, the mental foramen, to supply the skin of the lower lip and chin, the labial mucosa, the labial gingiva of the lower anterior teeth. The lingual gingiva of the mandibular teeth are innervated by the lingual nerve, don't forget that. And the buccal gingiva of the posterior teeth are supplied by the buccal nerve, which is the only sensory branch of the anterior division of mandibular. It supplies the buccal gingiva of the posterior teeth and skin of cheek, of course. Now, there are variations along the course of the inferior alveolar nerve. Most frequently, it runs as a complete trunk right below the apices of the roots of the teeth and gives short and direct branches until it emerges from the mental foramen as the mental nerve, as shown here. See, it's almost in the middle of the mandible. But in the 2 other cases, as shown here and here, the inferior alveolar nerve is closer to the border of the mandible. Now, less commonly, the main trunk of the nerve is more inferior in the body of the mandible, and so the branches to the roots of the teeth are longer and oblique, as shown here. In other cases, the inferior alveolar nerve also close to the border of the mandible, within the body of the mandible, gives off large branches that supplies the posterior teeth. This is a large branch that supplies the posterior teeth by forming a plexus, alveolar plexus. The main trunk of the nerve continues forwards in a more inferior plane gives off the mental nerve and supplies the anterior teeth. So either by short direct branches from the main trunk of the nerve, or by long oblique branches, and the nerve being lower down in the body of the mandible, as in these two cases. But in this case, it gives off a big branch that supplies the posterior teeth. These are the variations in the course of the inferior alveolar nerve. The blood supply also follows the nerve supply by inferior alveolar artery, a branch of the first part of the maxillary artery. As you remember, we studied this in the infratemporal fossa. You can refer to the lecture about the infratemporal fossa. The maxillary artery has 15 branches, the first part, second part, and third part, and this is in relation to the medial pterygoid, to the lateral pterygoid muscle in the infratemporal fossa. Now the lingual gingiva receives blood supply from the lingual artery. Venous drainage also to the pterygoid venous plexus in the substance and around the lateral pterygoid muscle. Lymphatic drainage of the oral cavity. It's important to learn about the lymphatic drainage because it's a plane for spread of infections and malignant tumors. The oral cavity drains mainly in the submental and submandibular lymph nodes, and both of them, they drain into the deep cervical lymph nodes that you can divide them into two groups. The upper group is the jugulodigastric lymph nodes, and the lower group are the jugulo-omohyoid lymph nodes. The submental lymph nodes drain a wedge of tissue comprising the lower anterior teeth, the central parts of the lower lip, a small area of the floor of the mouth behind the incisor teeth, and the tip of the tongue. The submental nodes usually drain directly into the jugulo-omohyoid, which is the inferior group of the deep cervical lymph nodes, but also may drain through the submandibular nodes into the deep cervical chain, the upper part. The submandibular lymph nodes are drain most of the oral cavity. The submandibular lymph nodes drain the rest of the mandibular dentition, the rest of the floor of the mouth, the lateral part of the lower lip, cheek, the upper lip, and the upper anterior teeth, and the anterior 2/3 of the tongue drain through the submandibular lymph nodes, the ones you see here. The submandibular nodes drain into the deep cervical nodes at various levels, either to the superior group, which is the jugulodigastric group, or the inferior group, which is more anterior. The anterior parts of the submandibular lymph nodes drain into the jugulo-omohyoid lymph nodes. And lymph from the upper posterior teeth, the hard and soft palates, drain into the retropharyngeal lymph nodes, and finally into the upper deep cervical lymph nodes. So this is the lymphatic drainage of the oral cavity. Now, to summarize the sensory innervation of the oral cavity, the maxillary teeth and supporting structures and the lining of the maxillary sinus supplied by the anterior and posterior alveolar nerves, plus the middle alveolar nerve if it's there, if it's present. The upper buccal gingiva innervated by the superior alveolar nerves, the labial gingiva and mucosa and skin of the upper lip receive their sensory supply from the infraorbital nerve, as shown here. The mucosa of the hard palate, including the palatal gingiva, supplied by the greater palatine nerve. This is the area of the greater palatine nerve. And and the nasopalatine nerve also shares in the supply, but in the incisor region. Here, this is the nasopalatine nerve region. The mucosa of the soft palate is innervated by the lesser palatine nerve. The lower teeth and supporting structures receive their sensory innervation through the inferior alveolar nerve, as you can see here. And also the incisive branch of the inferior alveolar nerve. Now, the buccal gingiva are supplied by the buccal nerve. The buccal gingiva supplied by the buccal nerve in the molar and premolar region, and the labial gingiva of the canine and incisors by the mental nerve, which is a continuation of the inferior alveolar, also supplies the mucosa and skin of the lower lip. The lingual gingiva are innervated by the lingual nerve, as you can see here. This nerve also supplies the floor of the mouth and the anterior 2/3 of the tongue with somatic sensations, as shown in this plate. Taste from the anterior 2/3 of the tongue is carried out by the chordotympany branch of the facial, but actually it runs with the lingual nerve, as we studied before. As you all know, that the chordotympany branch, after emerging from the pterygomaxillary fissure, after emerging from the skull, it joins the lingual nerve in the infratemporal fossa, and the lingual nerve takes it there to the anterior 2/3 of the tongue. The posterior 1/3 of the tongue, including the valate papillae on the V-shaped sulcus at the back of the tongue, receive both taste and general sensation from the glossopharyngeal nerve, which also innervates the mucosa over the palatoglossal folds. You know all about the palatoglossal and palatopharyngeal folds that bind the tonsillar fossa that holds the palatine tonsils in it. The mucosa and skin of the cheek is innervated by the buccal nerve. I hope you got the maximum benefit from this lecture, and thank you very much for watching.